The next muscle in our series of muscles that you may have forgotten about since school but really need to know about is TFL, which stands for tensor fascia latae. Which is this very small muscle, attaches to the ASIS and the greater trochanter from roughly here to here. It is, even though it is on the lateral side of our body, it is a medial rotator of the hip. And so right in this position with the leg folded 90 degrees, the TFL is actually going to run roughly from here straight down to there. And it's going to be a thin muscle about that big. And it's basically an assister for the IT band. And so in order to palpate it and know that you're on it, I'm finding it right now, but if I wasn't sure that I was on it, I could ask the client to leave their knee on the bolster and just lift the ankle, and that is going to internally rotate the femur. So go ahead and do that. Yep, and I should feel that pop up right under my fingers, which I do, and let that go. And it doesn't take a lot. Right in there is going to be more than enough. You could easily work on this in supine as well, but this spot right here is where it's going to be at. Go ahead and lift again. Yeah, and so even let go. So once you've got it, if you stick a thumb into it and just ask the client to do the same thing but very lightly, and let go. And lightly again, and let go. And lightly again, and let go. And that's going to allow you to sink deeper and deeper into the belly of the muscle. One more time. There it is. Let it go. Good. All right.